So say you're walking along, minding your own business, and you see somebody collapse in front of you, and they're in need of CPR. A lot of people think, well, that'll never happen to me. But after performing CPR on 3 different people, I can tell you, it just might. CPR can save lives if performed correctly. So I will demonstrate how to perform the steps necessary to perform CPR and operate an automatic external defibrillator on an adult as told by the American Heart Association. All of the information that I compiled came from this DVD, Basic Life Support by the American Heart Association. So if you guys ever need to reference something, you can use this DVD. The first thing to know about CPR is when to perform CPR. If you see a person pass out, what steps should you take before performing CPR? The very first step is to assess for scene safety. That way you can make sure that you're not causing any further injury to yourself before you try and save this person. You want to look for any hazards that might obstruct care or cause any further injury to your patient or yourself. The second step is to try to arouse the patient. Ask, are you okay, while forcefully shaking them. You want to ask loudly and you want to be forceful about it because you want to try and look for any signs of arousal. So, are you okay? Are you okay? The next step can vary. For the untrained rescuer, the American Heart Association says that you should look for breathing by looking for rise and fall of the chest. For the trained rescuer, they train that you should look for the carotid pulse. So first, by finding the carotid pulse, you want to find the trachea, and then move your fingers to the notch that is right next to it, and that should feel for the carotid pulse. So when you are feeling for the carotid pulse, you want to feel for a maximum of 10 seconds. If you do not feel a definite pulse, or if the patient is not breathing, then you want to start CPR with chest compressions. Good chest compressions are essential to survival when performing CPR. Chest compressions should be performed on the lower half of the victim's breastbone, and the landmark for it would be about nipple line. Compression should be at about a depth of 2 inches or 1/3 of the victim's chest, and you want to go at a rate of 100 to 120 beats per minute. A good way to find a good rate for it is going along to the chorus of Staying Alive or Another One Bites the Dust. Start by exposing the victim's chest. My mannequin's chest is already exposed, so can't do that, but the next step would be you want to place the heel of your hand on that landmark that I just talked about. You want to link your fingers, lock out your elbows, put your shoulders over the victim, over their chest, and push down, and then let up. When you push down, it pushes all the blood from the heart. It pushes oxygenated blood from the heart to the rest of the body. And then when you let up, you want to allow for full chest recoil, because this will allow the heart to adequately fill with blood. If you do not allow full chest recoil, what will happen is the heart doesn't fill with enough blood to be pushed out during that next chest compression. After 30 chest compressions, you'll perform 2 rescue breaths. There are 2 ways, or actually 3 ways, to perform rescue breaths, with or without a barrier device, or not at all. It is preferred to have what's called a barrier device to perform rescue breaths, such as a pocket mask. So this is what a pocket mask looks like. The American Heart Association does, however, say that if a barrier device is not there, if you don't have one, you don't know the patient, then compression-only CPR is also appropriate. With a pocket mask, you'll want to place the nose, and usually it indicates where the nose is, but if you have any trouble finding it, this is pretty triangular, so you just want to put the point of the triangle on the bridge of the nose, and then you want to make a seal while also performing the head tilt chin lift, and this will open the patient's airway. And then what you'll do is you'll bend over, and then you'll give 2 breaths over 1 second. Each breath is over 1 second, pause, and then do another breath over another second. If you do not have a barrier device, you can give mouth-to-mouth by using the head tilt chin lift, pinching the nose, and creating a seal over the mouth, and that's called mouth-to-mouth. But like I said, if you're not comfortable with that, you can always just do compression-only CPR. Respiration should be given, I said that, sorry. Always look for rise and fall of the chest whenever you're giving respirations. Once the 2 respirations are given, immediately resume chest compressions. and continue until help arrives or an AED arrives, and then in that case you'll use the AED. The automatic external defibrillator, or AED, is essential to survival when performing CPR. The AED is responsible for correcting 2 abnormal heart rhythms, ventricular fibrillation and ventricular tachycardia, by sending a shock of electricity to the heart that kind of jump starts the heart. All AEDs are the same in how they're operated. The first step for every AED, and this is the AED, is to turn on the AED. And then the second step, always the same, follow the prompts.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Okay, so I'll turn that down. I'll pause it. So when you're applying the pads, most pads will have a diagram as to where you are supposed to put the pads. You want to put it on the upper right side of the patient's chest, one pad. And then the other pad will go right on the left lateral side of the lower chest, right by the nipple. So then you'll do that, and then it says to
apply pads, plug in connector.
And then plug in the connector, and this is the connector.
Analyzing heart rhythm.
Once it starts to analyze the heart rhythm, you are to not touch the patient, and it'll tell you that. So then you just wait on the next step. So if the shock is advised, it'll charge, and it'll give you the signal to go ahead and shock the patient. It is very important that you clear the patient. You want to make sure that nobody is touching the patient. You want to verbally clear, and you want to visually clear. So you want to look up and down and say, is everybody clear? Once everybody's clear, you'll say shock given, or giving shock. Shock delivered, and then you would just continue with CPR. So CPR is a cycle of chest compressions with respirations, as well as using an AED if one is available. When performed correctly, CPR can increase the rate of saving someone's life. Hopefully now you'll feel a little more confident in what to do in the event that you ever need to give CPR on an adult. So, thank you.